Hello, I'm Calvin Rhoads. I go to Highland High School and I'm going to be a senior. This summer I was in the radiology internship program, and the study I was doing was personnel dosimeter use in regards to occupational exposure during fluoroscopic exams by me, Calvin Rhoads, and my mentor, Mindy Bolger. This study was performed in the cardiac cath lab, where catheters are used aided by fluoroscopy for diagnostic purposes. All personnel in the cath lab are required to wear a dosimeter to measure the amount of radiation he or she has absorbed. The problem: most personnel's radiation measurements have continually been 0 milligrays, despite working around radiation daily. The radiology department in Medina Hospital did not believe that it was correct for personnel to have readings of 0. The purpose was to investigate the radiation readings amongst staff and physicians working in the cardiac cath lab. 3 factors that were possible to affect the radiation readings were evident. The first one was dosimeter placement. This was most obvious because proper readings necessitate that personnel dosimeters are worn outside the lead vest at thyroid level. The readings may be much lower than what they should be if dosimeters are worn under lead vests. The second factor was use of lead shielding. Using lead shields to cover radiation source is important because the shields absorb a significant amount of scattered radiation. The last factor was distance from the radiation source. The personnel's proximity to the source of radiation depends on his or her role in the procedure. Distance was essential because radiating energy decays at an inversely squared rate as distance increases from the source of radiation. Hypothesis: if one or all of these factors change, the personnel's radiation readings will reflect these changes. This study was focused entirely on personnel operating out of the cardiac cath lab in Medina Hospital. A total of 11 personnel were studied in procedure over a period of 7 weeks. Each had a film badge dosimeter, which was read monthly for radiation exposure. 27 procedures were monitored to analyze each individual's tendencies of proper dosimeter placement. Dosimeter placement was never stressed to the personnel by the observers so that their normal placement habits persisted. The procedure records were then reviewed for all procedures performed during March 10th through June 9th in 2011 in the cardiac cath lab. Each procedure, personnel filled the roles of physician, scrub, and circulating nurse. These roles require the personnel to be at different proximities to the radiation source. The monitor position was exempt since no possible contact with radiation was evident. The amount of radiation each personnel was exposed to, his or her role in the procedure, and his or her dosimeter placement habits were then used to compare the personnel's radiation readings. In analyzing physicians, shielding habits were also compared. And here's the data for procedures and radiation. The physicians are listed with the amount of procedures they were in, also the radiation which was exposed to the patient during the procedure, and then it gives you the radiation that they actually absorbed. And that goes through with the scrub group and the nurse group. And as you can see, there is several personnel with radiation readings of 0 on the far right side. And here is the placement in procedures observed. On the far left side is the number of procedures that were observed by the observer. And then on the next 2 columns is the correct placement and incorrect placement. And it just shows what their tendencies were for the most part. And some general observations. Physician 1, he was the best at both placement and shielding habits. Physician 2 had good placement but poor shielding. Physician 3 had poor placement and very poor shielding habits. Physician 4 was only watched once but did not wear a badge according to personnel. And Physician 5 was never watched, but according to personnel, he had extremely poor shielding habits. Scrub 1 had perfect placement habits. Scrub 2 was never watched in procedure but had incorrect placement habits. Nurse 1 had good placement. Nurse 2 had poor, as well as Nurse 3, and Nurse 4 had perfect placement habits. And the results. Physicians. They averaged about less than 1 meter from the radiation source during procedures, and on the right side, the chart gives you the amount of radiation exposed to the patient during procedures, and it just is comparative amongst all the physicians. And on the right side is the radiation that the physicians absorbed. And you can see there are some discrepancies with the ratio of, for instance, physician 1, who accounted for about 3/4 of the radiation exposed to the patient during procedure. He only accounted for about 1/5 of the radiation absorbed. And another large change was in physician 5, who accounted for 0% or less than 1% of radiation exposed during procedures, but then accounted for 7% in procedure of the radiation he absorbed. And as well as number 4, who had a radiation reading of 0, so she accounted for 0% of radiation absorbed. And with the physicians, on the right side is just comparing the physicians and their habits with rankings. And on the right side is the rate of the absorption. This is the amount of radiation that was exposed to the patients, and then this shows how much of that radiation they actually absorb. And physicians 1 through 3 are normal. Physician 4 has 0%, and as you can see on the left side, physician 4 has the worst use of dosimeter, so it shows that that has a severe impact on her reading. And physician 5, who has an outstanding rate of absorption, this is because, as you can see on the left side, he has the least use of shielding. And onto the scrubs. They averaged about 1 to 2 meters from the radiation source. And again, there's the radiation exposed during the procedures they were in and the radiation they absorbed. And as you can see, scrub 2 accounted for 0% of the radiation absorbed. And on to the right side, scrub 1, who has only about 0.5% of absorption rate, which is completely normal. But then scrub 2 has a 0 because if you recall back to the data, scrub 2 did not wear her radiation badge correctly. And then onto the nurses. They averaged about over 2 meters from the radiation source. And the radiation absorbed, they're all about even in that category, but then the radiation absorbed was completely 0. And obviously the rate's going to be 0. And this was one of the main problems because none of them absorbed any radiation. And for the conclusions, proper dosimeter placement had a substantial impact on radiation absorption. However, this was only obvious in physicians and scrubs. The nurses showed no change whether proper placement was implemented or not. The reason for the disparity amongst the personnel's roles and their radiation readings was due to the distance factor. Physicians were the closest to the radiation source and received the highest amount. Scrubs were close behind. They're in the secondary beam, and they received a slightly lower rate. And nurses, who were the furthest away, received no radiation. The physician's use of lead shielding had a tremendous impact on the absorption rates of personnel near the radiation source. Physicians who used adequate shielding had minimal absorption rates, but those who failed to do so had much greater rates. In conclusion, it is possible for someone to have a radiation reading of 0 milligrays when wearing a dosimeter correctly, if she or he is only a circulating nurse. This is due to the fact that circulating nurses are the furthest from the radiation tube, and not because of improper dosimeter placement. Those operating as a physician or scrub will always have a radiation reading above 0 if dosimeters are properly used. It is imperative that all opportunities of shielding are utilized by physicians. If no shielding is used, radiation absorption levels might cause injury to physicians and scrubs after years of operation around fluoroscopy. All personnel wore protective lead vests during every procedure, but it is important that personnel make an effort to properly place dosimeters so that radiation readings are more accurate. This is especially stressed for physicians and scrubs. Even though nurses absorb no radiation due to their distance from the radiation source, dosimeter placement is also important because to document unexpected absorption of radiation. All personnel should stay as far away as possible from the radiation source while still being close enough to deliver excellent patient care. And those working with fluoroscopy should always be aware of distance from radiation source, use of lead shielding, and dosimeter placement to ensure accurate readings, but also to lower radiation absorption. And my acknowledgments, I'd like to give a special thank you to the Cleveland Clinic Office of Civic Education Initiatives, Medina Hospital X-ray Department and Cardiac Cath Lab, and my mentor, Mindy Bolger. Thank you.